Direct from the World Health Organization interim guidance from June 5th, 2020. Advice on the use of masks in the context of COVID-19. Potential benefits and advantages. The likely advantages of the use of masks by healthy people in the general public include reduced potential exposure risk from infected persons before they develop symptoms, reminding people to be compliant with other measures such as hand hygiene, not touching nose and mouth. However, this can also have the reverse effect. Potential social and economic benefits. Amidst the global shortage of surgical masks and PPE, encouraging the public to create their own fabric masks may promote individual enterprise and community integration. Moreover, the production of non medical masks may offer a source of income for those able to manufacture masks within their communities. Fabric masks can also be a form of cultural expression, encouraging public acceptance of protection measures in general. The safe reuse of fabric masks will also reduce costs and waste and contribute to sustainability. Reduced potential stigmatization of individuals wearing masks to prevent infecting others, source control, or of people caring for COVID-19 patients in non clinical settings, making people feel they can play a role in contributing to stopping the spread of the virus. Those were the potential benefits and advantages of using a mask by a healthy person from the World Health Organization. Potential harms. Can I do the potential harms and disadvantages? By- It's okay. We now continue with World Health Organization interim guidance on mask wearing by healthy people. We continue with the potential harms and disadvantages. The most like the likely disadvantages of the use of mask by healthy people in the general public include potential increased risk of self-contamination due to the manipulation of a face mask and subsequently touching eyes with contaminated hands. Potential self contamination that can occur if non medical masks are not changed when wet or soiled. This can create favorable conditions for microorganisms to amplify. Potential headache and or breathing difficulties depending on the type of mask used. Potential development of facial skin lesions, irritant dermatitis, or worsening acne when used frequently for long hours. Difficulty communicating clearly. Potential discomfort. A false sense of security leading to potentially lower adherence to other critical preventive measures such as physical distancing and hand hygiene. Poor compliance with mask wearing, in particular by young children. Waste management issues, improper mask disposal leading to increased litter in public places, risk of contamination to street cleaners, and environmental hazard. Difficulty communicating for deaf persons who rely on lip reading. Disadvantages for or difficulty wearing them, especially for children, developmentally challenged persons, those with mental illness, elderly persons with cognitive impairment, those with asthma or chronic respiratory or breathing problems, those who have had facial trauma or recent oral maxillofacial surgery, and those living in hot and humid environments. That has been the list of potential harms and disadvantages brought to you by the World Health Organization, a pet project of Mr. William Gates. Bill Gates.
Wow.
Is that not mind blowing or what?
Yeah, I'm sorry I interrupted you earlier. And actually, what I'm really sorry about is that my microphone was actually muted. So in the middle of your video, you're interrupted by silence, and then you respond to silence on the video. More than likely, that's how it's going to show up on the audio when I play it back.
Whatever. So yeah, so I was just reading that is what the World Health Organization says about the masks. And there's nothing about health. They don't mention anything about protecting you from disease.